got Stephen Tucker. He is with Health Insurance Mentors, and he's an Obamacare expert. And I asked him to come on because there's just been one alarming report after another about Obamacare fraud. And these are the Obamacare plans. And federal regulators apparently have a real coverage, because a real problem with this fraud, and they can't seem to get a handle on it. So here to talk to us more about that is Stephen Tucker. Thanks for joining us tonight.
Hi, Jeanne. If you think $5 billion is bad,
yes,
try spending $1.4 trillion. These are the Congressional Budget Office estimates after what President Biden and his team did. They expect us to spend in the next 10 years on Medicaid expansion, $1.4 trillion, and $1.3 trillion in enhanced Obamacare subsidies, right? Now, you know, any estimate that anybody on the federal level makes, certainly the CBO, is always way under what actually is going to be spent. And why is this happening? And why is there so much fraud going on? Well, we have to go back a bit, about 10 years, when the NFIB, National Federation of Independent Businesses, they had a lawsuit that went all the way to the Supreme Court contesting two things: the individual mandate, the cudgel to force you to buy health insurance or be penalized, right, or taxed, as Barack Obama stated it would be, and then the forcibility of states to force them to expand Medicaid, right, blowing up their state budgets. As you know, that's the largest line item on any state's budget, including here in bankrupt Illinois. And so the threat from the Obama administration at the time was either you will expand Medicaid to perfectly healthy adults. Remember, Medicaid was supposed to be a safety net prior to the ACA, Affordable Care Act, for those who were blind, children of the poor, the developmentally disabled, those with renal failure, et cetera, right? And then the ACA expanded it to anyone with a pulse who happens to earn less than 138% of the federal poverty level, which is a constantly changing number. This year, that equates to $20,782 a year for a single tax filer, right? So today, anybody can get that. So a variety of states, about 36 of them, joined together in a lawsuit suing Sebelius through HHS, Kathleen Sebelius, the former director. And they won in the U.S. Supreme Court in that the federal government could not force states to expand Medicaid, because the cudgel they were using to force them was, if you do not expand Medicaid to perfectly healthy people earning less than $20,782 a year, we will withhold all funding, not just funding for the perfectly healthy people, but for those who cannot help themselves, developmentally disabled. So it was a very cruel thing for the Obama administration to do. And the Supreme Court agreed that it was cruel, and the states won. So in those states, like Florida and Georgia, for example, they did not have to blow up their state budgets, and therefore they did not expand Medicaid thanks to the U.S. Supreme Court. Fast forward to 2022 and the quote-unquote COVID-19 pandemic and the Biden administration, and they passed something called the American Rescue Plan. And in the American Rescue Plan, they enhanced federal subsidies for people earning almost 600% of the federal poverty level. So I'll just give you an example. Two 60-year-olds today in the state of Florida, Orlando zip code, can earn up to $300,000 a year and still receive an advanced premium tax cut, federal health insurance subsidy. Why are we subsidizing people earning $300,000 a year? I have no idea, but that's exactly what we're doing. Now, the other thing they did in the American Rescue Plan, which of course was set by congressional law in the IRA, the Inflation Reduction Act, it was extended all the way through 2025. That was the enhanced subsidies for people making $300,000 a year, which is ridiculous. And then in the states that did not expand Medicaid, because they sought not to seek blowing up their state budgets like we have done here in Illinois, like Florida, people earning under 150% of the federal poverty level, right, and between 100% of the federal poverty level. So let's use that same married couple earning $30,000 a year, right?
Right.
Which is below 150% of the federal poverty level. They can now get ACA plans, Obamacare plans, for no monthly premium. None. And in fact, greatly reduced deductibles as well. All, of course, being paid by the federal taxpayer. Okay? Now, this is millions of additional people that can get totally free plans from Blue Cross Blue Shield, for example, in Florida, at no cost to them, and even subsidies reduced down, even deductibles reduced down to zero, all courtesy of the federal taxpayer. Okay?
But wait, let's stop there for a minute. You know what happens here, though? Like, people actually go to work and get a job just to have health care from their employer. Yes. And now you basically don't need to do that because you can get on an ACA plan and just have regular health insurance and not pay anything for it.
That is a brilliant point, and I will tell you why it's brilliant. These enhanced subsidies are scheduled to end in 2025. And already our friends on the left, which I have zero, in Washington, D.C., are accusing Republicans of not wanting to help the poor by rolling back the enhanced federal subsidies to where they were before, right? So that's going on right now. So that's going to be another big battle, certainly if Biden wins re-election. They'll definitely make it something that's permanent. And when that happens, of course, we're going to blow up the state's budget. We're going to blow up the federal budget even more. I mean, I'm talking $1.4 trillion. And, of course, the CBO is always wrong. They always estimate super low. It's going to be way more than that, right? So that's what we're facing. That's what happened. And the problem with that, of course, is it's always under the guise of trying to help people. We're trying to help people. We want to make sure they get covered, et cetera. So now what's happening is, I'm going to tell you on a personal level, under President Obama and President Trump, there was very strict income verification requirements. If you applied for an ACA plan and you sought an estimate of what your income would be by the end of the year, by the following year tax time, you had better been right about your guesstimate of your income, or you will owe money back to the federal government for any amount of subsidy that you took that you weren't actually eligible for once your income is determined, right?
Right.
Then I started seeing things change under President Biden. So many people no longer had to provide any evidence of their income. They no longer had to upload their 1040, the federal 1040 tax return. All of this became very lax on income verification. I'm thinking, what is going on here? And now here's a new development for you. Because those who are agents and brokers who do not have a conscience, they can enroll people through healthcare.gov and other parts, federal facilitated marketplace exchange.
This is where the fraud comes in, right? This is where the fraud is coming in. These agents are enrolling people without verifying things. They're taking their cut on that enrollment because they're a broker for the insurance company that's getting paid by the federal taxpayer, and they're just rolling these people around.
That's correct. So now here's what I have to do. Instead of logging in, right, every 30 days and verifying with Centers for Medicare and Medicaid Services so I can continue to be a broker, right? I now must verify my identity every 12 hours, Jeanne. That is how bad the fraud is now. Every 12 hours I have to link up back to CMS. And I'm not doing anything wrong, right? So add to that all the fraud that's going on, right? Then the fact that so many people are getting federally subsidized private health insurance plans from Blue Cross, for example, and also being enrolled in Medicaid. So the health insurers are taking double subsidies, not just for private plans, but also through Medicaid.
Okay. I mean, it's like, I love talking to you, but I'm just infuriated at the incompetence. People get paid a lot of money to have to run these plans, to run these organizations, to run the healthcare.gov. And we get is incompetence. Secret Service, education, healthcare, COVID, pharmaceuticals, liars all around.
Yep.
I don't know what to do. I guess I'm just going to keep talking about it until people wake up and vote differently and put in competence. Hey, we got to leave it there. I want to thank you so much for joining me tonight. I really appreciate your efforts in this area. You are the expert. So thanks a lot. And we'll be right back. We're going to take
Real Story with Jeanne Ives continues on AM 560. The Answer.